Hello, my name is Cassandra Thayer. In my visual presentation, I will be covering the topics of wildlife diseases and how we as humans communicate their effect on our health and our lives. Though there are many zoonotic diseases, I have focused my research on rabies and West Nile virus since they are relevant to my profession as an animal control officer. In the United States, we don't often think about rabies because it is a disease that mostly affects communities with poor healthcare systems, such as Ethiopia. Though rabies has been preventable since the 19th century with vaccinations for animals, it is still one of the most deadly zoonotic diseases in the world. Several different variants of the virus, which are kind of like different strains of the flu, are found in North American wildlife, which threaten not only public health, but the health of our domestic pets as well. West Nile virus, on the other hand, is not as deadly, but remains a large concern of the North American population since its outbreak in New York City in 1999. Stemming from an enzoonotic cycle with birds and mosquitoes, it can be difficult to trace exactly where an infection is taking place, especially because mosquitoes are so much smaller than mammals such as raccoons. With zoonotic diseases, people are often concerned or even scared. As an animal control officer, these folks want answers from me if they give me a call. They pose questions such as, is the coyote in my backyard rabid? Or, what do you think is wrong with this animal that is acting strange that I saw? It's my job as an animal control officer to educate the resident and make them more aware of what behavior is normal or not normal for the particular species that they're calling about. From what I can recall in recent times, I often see the news media reporting in the summertime about cases of West Nile virus and how they're popping up, which is really no surprise since it is most often transmitted from mosquitoes to humans. But what I don't recall being readily reported on is what we as members of the general public can do, or rather, what is being done to protect us. When considering solutions to the fight against rabies, three main things come to mind: domestic pet vaccinations and healthcare, oral rabies vaccinations, and quite simply, a plan to do these things. Pet vaccination is the simplest one. I'm not sure how they do things in other parts of the country, but here in Massachusetts, veterinary services are readily available and for a variety of costs. No matter what a person's income level is like, they have the ability to find a clinic and have their pet vaccinated against rabies. Additionally, there are procedures in place for if an animal bites a human or another animal. That animal, presumably a pet cat or dog, must go under a 10-day quarantine, followed by a rabies booster, in order to stave off disease transfer. Alternatively, if your pet comes home with a wound of unknown origin, such as if your dog went outside in the yard and suddenly came home and had a bite wound or some sort of wound on its shoulder, or has had an interaction with a wild animal that you know of, it is an automatic 4-month quarantine for the same reasons. In more recent years, oral rabies vaccinations for wildlife have been more readily used. Here in Massachusetts, we have a program that spans much of the southeast coast of the state, which distributes the oral vaccination through towns and has greatly diminished the raccoon variant over time. These photos that you see here on the left are examples of the program that is run in my area of the state, which includes southeastern Mass and Cape Cod. The brown squares that you see are rabies vaccinations wrapped in a delicious fish meal casing. And then when the animal bites into the bait, the liquid vaccination is orally consumed. Tasty for them, not so tasty or good smelling to us. Seeing a rabid raccoon, skunk, or coyote is going to be a lot more obvious than a mosquito carrying West Nile virus. Our plans to mitigate this disease has to involve human behavior just as much as it does the insect behavior. Fortunately, West Nile virus only has a fatality rate of less than 1%. It's great news for the general public, but with such a low rate, how do we get people to care about it? Currently, as far as I have noticed, there's very little media coverage of the disease, and many people do not talk about it as regularly as they might rabies. There seems to be little concern from the general public, which should change. There are things such as, this little sign that says, don't give West Nile virus a biting chance, but I think it needs to be more than that. So what can be done? Communication of the oral rabies vaccination efforts throughout the country should be more publicized, and as a result, we'll hopefully get more funding for them. As you can see by the graph below, cases for rabies in domestic animals has been significantly diminished since 1938, while wildlife rabies cases have grown. Having rabies vaccinations for animals has had a wonderful impact, but now we need to focus on our efforts on the wildlife as well. This can certainly be accomplished with more social media postings from not just wildlife professionals, but public health departments, veterinarians, local zoos, maybe even national parks. The same would go for West Nile virus as well. Social media being as prevalent as it is today, it should easily allow for the information to reach many different members of the community. Finally, the communication efforts surrounding these diseases and their prevention does not need to only focus on wildlife professionals and their efforts. Incorporation of what the public can do to help is just as important, if not even more important. Effectively communicating these steps can lead to all of us, including the wildlife, to live healthier and happier lives.